Hello, my name is Dr. Stephen Mulholland, President and founder of Spa Medica. We have been serving the Toronto and Canadian market with plastic surgery, cosmetic treatments for over 25 years. One of the most common plastic surgery procedures I perform is called a blepharoplasty or lid job. Typically, a lid job or blepharoplasty involves removing excess skin, fat, and some muscle from the upper lid and the lower lid. There are different types of blepharoplasty surgery. There's completely non-excisional blepharoplasty, where I take a little crimping device called the Accutite and the Morpheus Prime, and under local anesthesia, we can lift and soften the tissue around the eyes without any cut at all. There's a modest improvement with that very popular technique. Then there is a skin pinch blepharoplasties, the upper and the lower lid for modest lid excess, and then extended blepharoplasties where we have to remove the deep fat for bags, extra muscle, and a lot of extra skin. The lower lid can be done from inside the eye, called a transconjunctival approach, or from outside on the lower ciliary lash line, hiding that scar right along the lower lid. So there's many different types of blepharoplasty depending upon your skin type, the degree of pathology and aging, and it's one of those consultative procedures where we arrive at the best upper and lower lid procedure for you. Who are the best candidates for blepharoplasty surgery? Well, the most common kind of blepharoplasty is an upper lid blepharoplasty. It's done for patients who have a lot of hooding and extra flesh over their eyelid. In fact, it droops enough sometimes you can't even see the upper lid eyelashes. And so the best candidates are those that have significant redundant, droopy, soft tissue skin and muscle and fat pads of the upper lid and or lower lid, are medically well, understand there are some risks and benefits, and you need to have a certain amount of recovery, typically 1 to 2 weeks, and understand and are realistic about the kind of outcomes that can be achieved. Most patients can expect the kind of results that are very natural and are quite restorative. So most patients complain of being tired in their eyes, not old, but tired, by removing the extra hooded tissue, by removing fat pads, by smoothing wrinkles. We can make you look rested. You might look youthful as well, but rested is the most common result that patients experience and really enjoy about their blepharoplasty surgery. The recovery after blepharoplasty depends on the type of blepharoplasty, but typically an upper lid blepharoplasty takes 1 week. If you do upper and lower lid blepharoplasty, you typically need 2 weeks of recovery. It's hard to camouflage and hide the eyes. Doing that recovery process is not like body work, so you need to really commit to 1 to 2 weeks off depending on whether it's upper and lower lid. There are very few procedures that can duplicate what a blepharoplasty can do. Rejuvenation and removal of the tissue of the upper and the lower lid. There are some, however. Injectable soft tissue fillers can sometimes hide lower lid bags. Injectable Botox can reduce crow's feet wrinkles and elevate the brow. The use of the Accutite and the Morpheus has been a big innovation from InMode. Accutite, sort of like a waffle stamping device. You can treat the upper lid, crimp the soft tissue, and efface and remove upper lid hooding without even a scar. It's not as good as an upper lid blepharoplasty, but it's pretty darn good with some impressive results. Similarly, the Accutite can be used on the lower lid for lower lid bags. So we've got injectable treatments, we've got energy-based treatments with radiofrequency energy like the Accutite and the Morpheus, and then you move right up to the excisional opportunities in blepharoplasty surgery. Typically there is an upper blepharoplasty scar if you're doing an Accutite. Non-excisional, of course, there's no scar, and that's one of its big advantages. But if you're doing an excisional skin pinch blepharoplasty with or without muscle, the scar runs in the what's called the supratarsal fold above your eyelid and outer crow's foot, and typically the scars disappear. Very, very difficult to even see them after several months. The one scar area of the scar that often needs a little bit of treatment is in the crow's feet, and we offer complementary laser treatments, injection treatments to make sure that that crow's foot extension goes away. The lower lid, the incision is right under the lash line or inside the eye itself, so typically lower lid scars are not visible at all, and we include lower lid tightening treatments while we're doing the upper lid scar treatment management. So you can camouflage your upper lid scars and lower lid marks usually by about 3 weeks. Usually by about 6 to 12 months, the scars are not visible at all. Many patients choose Spa Medica for the upper and lower lid blepharoplasty because of the 25 years of experience, the artistic sense of which is what looks beautiful and attractive and rested without looking done, and the before and afters, and the skills of that comes with the experience I've had, and the double training in ENT, head neck oncology, and plastic surgery. Those all come together in a sense of reassurance that I'm going to be able to deliver the kind of natural and attractive lids that you're looking for. The past 25 years, I've done many television shows that outline, educate, and engage viewers on what a blepharoplasty or eyelid job is. Let's take a look at some of those TV shows.
Dr. Mulholland made a significant change in his patient Nicole's appearance by focusing on her upper and lower lids. Have a look.
I've never had any cosmetic surgery before, so this is the first one. The reason why I want to get this done is because it's genetically in my family, dark circles and puffiness around the eyes are very common. And as we get older, they get progressively worse. So since I turned 40, I started noticing a big difference in the puffiness. And I'm just really tired of people always saying to me, I look tired. So I just thought this would be a great opportunity.
Nicole, so good to see you again.
Nice to see you too.
Nicole's procedure was an upper and lower lid blepharoplasty with a little bit of under the chin skin lipocontouring. So the procedure would be divided into upper and lower. In the upper lid, generally we're looking at extra skin, maybe a little extra muscle, sometimes fat. So we remove a little bit of skin, a little bit of fat, a little bit of muscle, and we hide that incision in the upper eyelid crease so you can't see it. In the under eye, we use a very stealth approach. We take the fat pads out from the inside of the eye where the pink is. It sounds kind of gross and kind of creepy, but remember it's under local anesthesia, so we steal the fat pads from behind, so actually there's no lower lid scar. There can be some bruising, there can be some discoloration around the eyes because there's a lot of little vessels, and so most patients should anticipate 1 week off and then into makeup.
I feel great. It's the first time that I can actually go out and not have someone look at me and go, wow, you look really tired. There's no puffiness. It's just smooth skin. It's easy to apply makeup. And it's just, overall, I feel younger.
It's dramatic. Please welcome Dr. Mulholland live in studio with us. That is amazing. So she only had to do that once.
Yeah, one-time procedure.
One-time procedure. Now, I always start with this. Is it painful at all? Because you think about the skin around the eye, it tends to be thinner, which might make it a more tricky area to deal with. Is it a painful procedure?
You know, the eyes are really probably one of the most common things that we do because they are the windows of the soul, and that's where we're trained to watch.
Yes.
And society's trained us guys never to look at cleavage anymore, so we look right at the eyes.
You're so not allowed.
Right at the eyes, and of course, the windows of the soul are sometimes guarded by the gates of hell.
Yeah.
And that's skin, discoloration, and bags. And so it's delicate tissue, but not overly painful. Like a bruise meets a sunburn for about a week. Far less painful than looking old and tired when you're not.
Yeah, absolutely. Now, what are the risks, if any, involved with this?
Well, like any plastic surgery, there's going to be some risk, but it's a fairly small area around a delicate organ, the eyeball.
Yeah.
So you want to protect the eyeball from injury, and then usually it comes down to bruising, slight asymmetry, delayed recovery, usually things that can be adjusted or fixed. Usually eyelids work out very well.
How long is the recovery process anyways?
Depends what you do, but in general, it's about a week until you're into makeup. So there's none of this sort of weekend or overnight recovery. And usually start with diet and exercise and maybe a little Botox and filler and great makeup like our artists today. But at the end of all that stuff, sometimes hereditary issues catch up with you and you just got mom and dad's bags, and sometimes even when you're a teenager you look in the mirror and go, oh my goodness, you know, this is hereditary, not aging. So
it is a hereditary thing. Is there a certain age when people, like, it's a better age to opt for this whole eyelid procedure? You know,
if let's say you inherited a big eye and a sunken socket and dark bluish skin and bags and you're in your early mid-20s, rarely, sometimes that's when you start, but for the most part, eyelid surgery takes over from Botox filler and photofacials and healthy living in your mid-30s to 40, often it's the eyelids, and then mid-40s the brow and cheek, and then maybe in your 50s, 60s the neck. So you're renovating one room at a time, and the eyes are the first room.
Right. So, but does it make a difference if you do it at 20, 30, 40, or 60? Does it make a difference?
Not really, because the fat we remove never ever comes back. And sometimes the skin wrinkles will come back and a little laser will take care of that. But it's usually one surgical maneuver to renovate the eyelids, and you're usually good for the rest of your natural born days.
That's amazing. Does it change at all the skin tone, or does your actual skin tone make you more or less eligible for this sort of a procedure?
So the darker the skin, the less likely we're going to use laser treatments, and then we use other tactics for darker skin types. And so Asian or Canadian, Caribbean patients are candidates, just with different techniques. The lighter the skin, the more often we can deploy laser work for some of the fine lines and wrinkles.
And why is that? What do the lasers do on darker skin?
Well, generally for the lower eyes, when you're trying to get the little crinkly crepey skin, you're going to use a laser that may alter the pigment. And if you have light pigment, then it won't be as much of an issue. When you have darker pigment, usually we rely more on skin pinching and removing.
Okay, and what are we talking about in terms of cost? Is there a range?
It really depends whether it's upper or lower and how difficult each of the lids are. But in general, most Canadian patients can look at somewhere between $2,500 and $4,500 for uppers alone or upper lowers together.
Okay. Nicole got a little bit of upper and lower done, and she's actually in our audience right now. Such a dramatic before and after. So, Nicole, I want to ask you this. You look absolutely stunning. Why did you decide to do this now?
Now, because I'm 43, there's been a lot of changes in my life, my personal life in the last year and a half, and I thought, what better time to do something for myself than now? So I went ahead and booked the appointment. And it's also, like Dr. Mulholland said, it's hereditary, and I have an older sister. She's 3 years older than I am, and I've watched hers progress to a point where she really wants hers done, so I know that mine will continue to get worse, and I thought, let's just nip this in the bud now and go ahead and do it. I feel great.
You look phenomenal. You look so good. And there are so many people that are on the fence when it comes to getting some kind of a cosmetic procedure because, you know, they're afraid of the pain like I am, or they just don't know if it's worth it or not. If you're getting up every day and someone's saying to you, you look tired, there's something really annoying about that. And, you know, it's one of those situations where it is hereditary. She didn't really have any control over the situation. It made perfect sense.
It's completely true. I mean, many of my eyelid patients, blood patients, would never do a facelift. They're never going to do liposuction. But they've been afflicted with something that no matter how much rest they get, there's probably nothing, well, more annoying than someone said, oh, did you get any sleep last night? You got a wonderful sleep. And so blepharoplasty surgery is restorative and functional in that sense, and not only just cosmetic. It really does make you look more rested. It's not about youthful all the time. It just makes you look fresh, alert, and rested.
One of our favorite people on this show is our fabulous stylist, Maggie Bill, who does an amazing job.
She certainly does, and she's been with us from the very beginning, although now she looks a whole lot different.
She does, and it's due to her recent plastic surgery, which was a decision she didn't make lightly.
And now you're invited to witness her dramatic transformation.
I've done my research, going to the best doctor in town, see what happens, see what they can do for this.
After careful consideration, ET Canada's hard-working stylist Maggie Bill has decided to get a facelift.
Okay. Well, I was looking through your health history, and you're 60-ish.
Yes.
60-ish years
getting
young.
up there.
What's your goal? What do you want to achieve?
Well, I'd like to freshen up my face, to not look so tired and not look so burnt out. I have an invention of a new dress that I've invented called the Maggie dress, and they've requested that I go on television when they introduce this dress on the Shopping Network. And I just feel like getting a little bit fresher look, be much more confident in my presentation.
So what's Dr. Mulholland's solution?
We take this extra stuff you don't like. There's the extra flesh.
Right.
And we make a small incision under the chin, some very hidden incisions in the ear and hairline, and we should be able to give you this type of contour. So we're going to do a little telescopic or endoscopic mid-facelift from inside the hair, inside the mouth, take the cheeks and do that. And they're back up where they belong. So the last thing we're going to do is smoothing out your lid like that. To finish off or do the fine polishing, we'll do a little bit of very high-tech fractional laser under the eyes, brow, and around the mouth. So you're finished. The icing on the cake looks nice and smooth. We should have you looking 45, 46 forever.
Oh, I love you.
Okay.
So after 7 hours and $25,000 worth of surgery, how does Maggie look? We'll tune in tomorrow to find out. Yesterday, our sensational stylist, Miss Maggie Bill, was looking for a life-changing lift before her TV debut on the shopping channel.
And she turned back time with a complete cosmetic makeover involving serious surgery.
Now, the effects are dramatic, but was all the pain and healing time she experienced worth it?
We should have you looking 45, 46 forever.
Oh, I love you.
Yesterday, we introduced you to ET Canada stylist Maggie Bill just before she went under the knife with acclaimed Toronto plastic surgeon Dr. Mulholland.
I have an invention of a new dress that I've invented called the Maggie dress, and they requested, I wasn't expecting it, that I go on television when they introduced this dress on the shopping network. And I just feel like getting a little bit fresher look and looking a little bit younger.
It's pretty easy for you. You get to go to sleep and drift off and dream nice thoughts, and when you wake up, you will have shed about 15 years on your appearance.
This is kind of scary, but very exciting, so goodbye, old face. See you soon.
Months after surgery, the 60-something stunner is feeling more positive about her mega makeover.
You're not going to get results like this with, just a tiny little smidgen here and smidgen there. This requires major surgery.
One thing's for sure, she definitely achieved the desired effect.
One of the reasons that I even considered doing this surgery was because I was starting to look like burned out all the time. And I'm a very energetic person. I always felt I was feeling really tired, looking tired and just looking run down when I wasn't. I look younger, and you know what? I look healthier.
And she was ready for her moment in the spotlight as she sold hundreds of her dresses on the shopping channel.
If you want a little wider at the neck, you can just roll the neck like that there. Doesn't this look grand? I love it, I love it, I love it, and that is a wrap.